Okay, well, welcome, as I said, to today's talk. Don't be a dipstick. Confusion, UTIs and antibiotics. Very nice to welcome you all today to the training hub. First off, we're going to go through a few cases that are going to hopefully illustrate some of the things that we are trying to explore and discover today. So, case number one. 78-year-old lady who lives in a care home with a history of dementia, hypertension, osteoarthritis, and she's usually pleasantly confused but assistance with personal care only. And we get facts from the care home to their GP. Read this lady. She's been a bit more confused this morning and didn't want her breakfast. Urine is smelling stronger. Dipped, 1+ leukocytes, no blood, no nitrates, nothing else. Please can we have some antibiotics because we think she has a urine infection. Okay, so I see some shaking of the head, so you're one step ahead. Okay, does this sound familiar?
Yes.
Does it sound very okay? Good. I'm glad that was a yes also. Shall we treat? No. We got enough information?
No.
Quite a lot of information about her. What else do we want to know? We'd like to. Symptoms, really important.
Is she clinically unwell?
Is she clinically unwell? Yep, so symptoms, general condition. Anybody else?
Eating, drinking, more confused than usual.
Yeah, so baseline and whether she's eating and drinking. Anything else that's really that we might want to know? Sort of general condition. Absolutely. So, what should we do? Should we repeat the test? Any thoughts? No strong feeling either way there. So not resounding no, not resounding yes. And has anybody got a future plan for this lady? Thoughts? What needs to happen?
Just needs to observation.
So yeah, fluids, absolutely. Consider a fluid intake, consider a hydration. Anything else? I think generally comes. Sorry? Observation, absolutely, observations, and generally just gathering a little bit more information is the key thing here. Because it may be that there is something going on, but with just that sort of a little bit more confused, not really sure why, and then the urine dip done straight off doesn't really give us a full explanation of what's going on. So, case 2. 82-year-old gentleman, and he lives at home. He has 4 times a day carer, long-term catheter in situ, and with a past medical history of dementia, mild congestive heart failure, COPD, and sort of a mild renal failure. But he needs most assistance from most ADLs. So a note from reception comes through to you at practice. A urine sample was brought to you for this gentleman, which was meant to be for an ACR, but was dipped at the time. It had 2+ of leukocytes, 1+ of protein, and a trace of blood. It was sent for MSU, so that's for culture, and culture has come back showing high leukocytes with a culture of mixed bacterial growth. And the carers brought another sample, and it came back with 2+ of white cells in it. So familiar? Yeah, relatively familiar. Happens quite often. What else do you want to know?
Patient symptoms and
Yeah, absolutely. Similar to before. So symptoms, what's he like normally? What has changed at the moment? Was there any other particular reason that things were dipped, or was it just a sample that was brought?
Again, this could be a catheter sample because it's a long one.
Exactly, it is a catheter sample. Well spotted. So additional history. He feels well. He's a little more confused than normal. Confused, but no more than usual. No current concerns from carers. No pain, but he is irritated by his catheter. But that's pretty normal for him. Antibiotics for this fellow? No. Excellent, good. We're off to a good start there. Repeat testing? Sure. Yes. Okay, so what particular reasons might we want to retest this fellow? What's the situation?
Was it taken from the bag that's been on a week? So it's going to eventually win it anyway, isn't it?
Okay. So there was a few people thinking that maybe we might want to retest the urine. Hopefully we'll explain that and explore that a little bit as the evening goes on. Future plan for this fellow? Observations, watching again, liaising with the family, liaising with the carers, just to kind of keep an eye on what's going on here. Whether there was something that kind of that tipped them off that he might be unwell, or whether it's just normality. So case number 3, It's an 84-year-old lady who lives in a care home. She had 48 hours of lower tummy pain, pain when she goes for a wee, increased frequency, temperature of 38.7.8, and generally not feeling quite well. And she's seen by her GP. So her GP turns up, and he writes this note. Viewed at care home, abdo pain, dysuria, frequency, urgency, low grade temperature, a little bit more confused. But he notes from the notes that there's multiple UTIs over the last 6 months with several courses of antibiotics. She's a little bit unwell, she's a little bit tender, and he decided to do a urine dip. And he found that it was cloudy to look at, leukocytes of 3+, nitrites of 3+, blood +1, and he decided she had a UTI. Prescribed trimethoprim for 3 days, as symptoms were mild at present, and decided to review in 2 to 3 days or soon if she was unwell. And he also elected to send an MSU. Sound like a familiar situation? Sound like a fairly straightforward? Does anybody question Dr. Carl's judgment here? So day when he was being a GP and not a gynecologist or a psychiatrist. Sorry? Trimethoprim. Yeah, it's not usual first. Yeah, absolutely. Well picked up there. So case 3 continued a little. 72 hours later. Not only is there no improvement, but she's much more confused now. She started to spike her temperature. Absolutely. Brilliant. Jumping straight in there. Well done. And the urine culture report has come back. What do people think about the urine culture report? So S stands for sensitive, R stands for resistant.
It's not going to be treated with what she was prescribed.
She's got lots of resistance to the antibiotics there. So she's admitted, because as you correctly identified, she's suffering from sepsis. And so we look back through her notes. So 6 months ago, smelly urine, dipstick, leukocytes, given some antibiotics, not improved, given some more antibiotics. 5 months ago, similar. 4.5 months ago, recently finished course of antibiotics. Carers are worried, but she keeps getting this urine infection. She gets some more antibiotics. 3 months ago, a bit confused at that point. Strong smelling urine, pivmacilla now. And 2 months ago, she's a bit upset and agitated. She had some leukocytes in her urine, and she was prescribed some ciprofloxacin because the GP felt that they wanted to give her something a bit stronger, and the family were keen to give her something with a bit more, as they say, a little bit more oomph. But the patient developed a bit of diarrhoea, again familiar, but slowly recovered. So I sort of highlight there, and this is not an uncommon situation where this patient's had 6 courses of antibiotics of sort of increasing strength, increasing sort of broadness over the last 6 months. So just wanted to give those sort of cases to you, just kind of set the scene.